Welcome back to the Gut Health Dialogues. Over the next few weeks, we're going to be diving deep into methane SIBO because this is one of the most common issues I see in practice. And methane SIBO is very different from the hydrogen type you may have heard more about. It comes with its own unique set of challenges, from the way it shows up in symptoms to how we approach diet, treatment, and long-term resolution. In today's episode, we're going to lay the foundation. I'm going to walk you through what methane SIBO actually is, how it takes hold in the body, how it's different from other types of SIBO, and the pathophysiology behind why it creates so much trouble. And then over the next few weeks, we're going to cover the practical pieces: what to eat, what to avoid so you're not triggering symptoms, how to support motility, and how to address methane naturally and keep it from coming back. And yes, even what to do about that pesky weight gain that sometimes tags along with it. This is something I've been working on for more than 10 years with patients. And I can tell you it's one of the biggest drivers of symptoms in the patients we see at Nutrition Resolution. And we're a team of GI focused dietitians, and this is our wheelhouse, helping people actually resolve methane SIBO with the right support and strategies. So today, let's start with the basics, and I'll share some insights you probably haven't heard anywhere else. All right, let's dive in. If you've been wondering what methane SIBO is and why it's so hard to treat, we're going to talk about that now. If you've been eating clean, taking your probiotics, and maybe even tried a low FODMAP diet, but you're still bloated, still constipated, and feeling stuck, it's not all in your head. There's a good chance your gut is working against you in ways no one has fully explained to you yet. But we're going to change that today. That's where methane SIBO comes in. Methane SIBO, and SIBO is short for small intestinal bacterial overgrowth, is a common root cause of symptoms in many irritable bowel syndrome patients, especially those with constipation predominant IBS or IBS-C. It's one of the most underdiagnosed and misunderstood causes of chronic bloating and sluggish digestion and constipation. And it behaves very differently from the more commonly talked about hydrogen SIBO. Most people, and honestly, a lot of doctors, have never even heard of the newer term for it, which is IMO, and that's IMO. It stands for Intestinal Methanogen Overgrowth. So today I'm going to walk you through exactly what methane SIBO is, what causes it, how it's different from the other types, and how we test for it. And if you've ever felt like your gut is stuck in slow motion and no one's been able to tell you why, you are in the right place. So let's talk about what methane SIBO actually is, because a lot of people are walking around thinking they have it or being told that they don't without really knowing what it means. SIBO stands for small intestinal bacterial overgrowth, and it happens when microbes that should mostly live in your large intestine start growing too high up in your digestive tract. And in the case of methane SIBO, they overgrow. But here's where it gets interesting. Methane SIBO, not only is it not always caused by bacteria, but it also doesn't always happen in the small intestine. It's caused by a different kind of microbe entirely that's called archaea. The main one we know about is Methanobrevibacter smithii. And even though it's not technically a bacteria, it still causes all kinds of SIBO-like symptoms, especially bloating and constipation. These little guys feed on hydrogen, which is produced by other gut bacteria during fermentation. They feed on the hydrogen and they pump out methane gas in return. That methane then slows everything down: motility, digestion, and transit time. It slows down the large intestine and even the stomach emptying. So it's like someone flipped your guts off switch and just walked away. In fact, the term methane SIBO is slowly being replaced with IMO, which stands for intestinal methanogen overgrowth. And that's because these methane producing archaea can overgrow not just in the small intestine, but throughout the GI tract, including the colon. In fact, I recently had a doctor tell one of my patients, oh, we don't want to do a 3-hour SIBO test because that's going to tell us what's going on in the large intestine. And SIBO is only diagnosed in the small intestine. And boy, what a misunderstanding that is. She was a constipated patient. We were actually looking for methane SIBO. That's what I suspected she had. So, to say that we don't want to know what's going on in the large intestine, often methane SIBO or EMO is happening in the large intestine. So whether your provider calls it methane SIBO or EMO, we don't want to get too caught up in the name of it, but the symptoms and approach are pretty much the same. And if you're feeling frustrated because your breath test didn't show classic SIBO, but your digestion feels like it's stuck or in slow motion, you might be dealing with exactly this. All right, so the symptoms of methane SIBO usually center around slowness, sluggish bowels, bloating that builds all day, or food that just feels like it's sitting there. Here's some of the most common methane SIBO symptoms that we see in practice. Bloating, especially when it's in the lower belly, constipation, or incomplete bowel movement. So the word constipation can be confusing because people have all different ideas of what that means. To me, and in the context of this conversation about methane SIBO, constipation can even mean you could be having a bowel movement every day, but it doesn't feel like you're getting it all out. Maybe it's just a little bit, maybe it's small. Sometimes it can be hard, but it doesn't have to be. It could just be a little bit. So even incomplete bowel movements, gas that smells bad or lingers for hours, acid reflux or food coming back up hours after eating. Remember, I mentioned that when we're talking about slow motility, methane SIBO causes slowing in the large intestine. That's where we get the constipation or incomplete bowel movements, but it can also slow the small intestine, even the stomach emptying. And for that reason, we can see acid reflux or nausea or early fullness, where you just eat a couple of bites, you already feel full. It can kind of cause that general sense of slow digestion, kind of feeling stuck, or the belly feeling heavy, puffy, or distended by the end of the day. Also, we see unexplained weight gain, and some patients even experience paradoxical diarrhea with methane, especially those who also have inflammatory bowel disease or a history of gut surgeries. So while methane is typically linked to constipation, I've definitely seen cases where it triggers the opposite effect in some complex GI conditions. So that methane signals the digestive system to slow down across the board, from how fast your food moves to how quickly your stomach empties. And when the methane producing microbes overgrow, they send signals to slow motility. So instead of food moving smoothly through your gut, everything lingers longer than it should. So it's kind of like a traffic jam during rush hour. Too many cars, or in this case, microbes, archaea, are blocking the road, and there's not enough green lights telling your gut to go. That said, Methanobrevibacter smithii isn't all bad. In small amounts, it actually serves a purpose in your gut. It's supposed to be there. That's why we don't consider this an infection. It's not a pathogen. It's supposed to be in your gut. And in small amounts, it actually serves the purpose of slowing digestion just enough to give your body time to absorb nutrients. But when these microbes multiply beyond what your system can handle, that's when symptoms start showing up. Again, it's not just your colon that slows down. Methane can also delay how quickly your stomach empties, and that can help explain why we often see that nausea or reflux show up right alongside constipation, because food lingers too long in the stomach, and then it creates pressure and fermentation that push back up on the lower esophageal sphincter, causing the reflux. So if you're constipated and you feel refluxy or queasy after meals, you're not imagining it. Those symptoms are often connected by the same root issue. One of my clients told me she had the cleanest diet of anyone she knows. She ate all organic, mostly plant-based, tons of fiber, and yet she looked and felt more bloated than ever. And that's when we ran a breath test and found sky-high methane levels. She wasn't doing anything wrong. Her gut was just stuck. And if that sounds familiar, you'll definitely want to continue listening here. And just so you know, if you're ready to dive in and you need something to help you start feeling better right away, we also have a Methane SIBO diet guide. We'll talk more about diet in some of the coming episodes, but this diet guide will tell you exactly what to eat. It's a complete food list of what to eat, what to avoid, along with a 7-day meal plan to really help you hit the ground running with calming these symptoms down. The diet is geared toward decreasing fermentation so that you don't get as much gas production and bloating, and also helping support that motility with more regular bowel movement. So we're going to link to that in the show notes. And I just want you to know if any of these symptoms sound familiar, even if you've tried all the right things, methane SIBO could be at the root. So the key is understanding why your gut is reacting this way in the first place. And that starts with looking at what might have disrupted your system to begin with. So let's talk about what causes this to happen in the first place. Methane SIBO doesn't just happen out of nowhere, and it's rarely caused by just one thing. In most cases, it's a perfect storm of factors that shift the gut environment just enough to let these methane producing microbes overstay their welcome. Sometimes it's obvious, like a surgery, a bad case of food poisoning, or years of constipation. Other times it builds slowly through stress, diet, medications, or subtle motility issues that fly under the radar. So, some of the things that are the most common drivers I see, one is slow motility in the small intestine. And that can cause by a few different things. We're going to talk about that in a second. Another is long-standing constipation, which gives microbes more time to ferment and multiply. One of the main causes of that slow motility in the small intestine is food poisoning. Food poisoning can trigger SIBO by damaging the migrating motor complex, or the MC, which is the system in your upper digestive tract that clears bacteria and moves it along between meals, kind of like maybe a traffic director. And this happens when antibodies to bacterial toxins like CDTB, which is one of the toxins involved in food poisoning, cross reacts with MMC proteins like vinculin, slowing motility. And with that system impaired, microbes have more opportunity to overgrow, even if balance was not an issue before. Also, other gut infections can trigger this. So that would be things like parasites, viral gastroenteritis, or C. diff. They can disrupt the gut ecosystem and make it easier for archaea to overgrow, especially if recovery was incomplete or prolonged. Surgical history that may have impacted the gut's natural movement. Think of how many women have abdominal surgeries like C-sections or gallbladder removals. People have appendix removals, endometriosis, and because endometriosis can impair gut motility through inflammation or adhesions, where your reproductive organs are actually adhering to the intestines, whether it's an abdominal surgery or endometriosis, where there's inflammation. When we get adhesions, it's inflammation or scar tissue that's adhering to the intestines and causing them to kind of bend and kink in places where they would normally be smooth. And that allows food and bacteria to build up. So that's how we get the bloating and the constipation. And then chronic stress. Chronic stress is the big one, and it disrupts the gut-brain axis, which governs motility. It also slows digestion. It decreases our digestive output of enzymes and acid and bile release, those things that help us digest our food and kill bacteria that's coming in through our digestive tract. Chronic stress also weakens the immune system's ability to keep microorganisms in check. Low stomach acid or bile flow, which normally do keep microbes in check. And then frequent use of certain medications. So, for example, proton pump inhibitors can be associated with, because normally our stomach acid helps keep microbes in check, and these medications decrease our stomach acid. Opioids, slow motility, and antibiotics. If you have a lot of antibiotics that you're using for something, can also affect the microbiome composition and be a risk factor for SIBO. Also, subtle dysbiosis or depleted microbiome. So if you have past infections or you've been treated with lots of, aggressive kind of treatment of antibiotics, this can shift the terrain in your microbiome. So think of a garden that's been really picked over, or a lot of the plants have died and been killed. Well, that leaves a lot of gaps for weeds to overgrow. So this is what we can see happen in our microbiome. I'm talking about our large intestinal microbiome, but some of those weeds can be very hardy, and that can create a terrain where weeds can overgrow and methane producing microbes can take over. Again, if it's in the large intestine, it's still considered methane SIBO. We call it, that's why we're starting to call it EMO. Some people also have genetic or microbial factors that can lead to excess methane producing archaea, especially Methanobrevibacter smithii. So that can also be a factor. I once had a patient who was dealing with constipation for years, and she just thought it was her normal. Then she got food poisoning on vacation, and suddenly her mild symptoms turned into daily bloating, gas, reflux, and irregular bowel movements. When we tested, her methane levels were through the roof. So she was already prone to constipation, and that one trigger, food poisoning, pushed an already sluggish system into full-blown overgrowth. And again, we'll cover more about how we approach this healing process step by step in one of the episodes coming up in a few weeks. So at Nutrition Resolution at our practice, we are always looking for the why. What shifted in your gut that allowed these organisms to thrive? What upstream patterns have been going on for years that nobody ever pieced together? And that's the level we work on, because resolving methane SIBO isn't just about killing the overgrowth, it's about restoring function and preventing it from coming back as well. So now let's talk a little bit about methane SIBO as it compares to regular SIBO. And I'm calling it regular SIBO. When most people say SIBO, they're usually thinking of hydrogen dominant SIBO, which tends to come with classic IBS-D symptoms: diarrhea, urgency, cramping, and bloating that start shortly after eating. So it's often described as a gut that's moving way too fast. Methane SIBO or EMO behaves very differently. And instead of speeding things up, it slows everything down, causing bloating that builds up throughout the day and constipation that doesn't respond to usual strategies, along with very often reflux, nausea, and sometimes even bowel movements that alternate between constipation and diarrhea. We actually see that quite commonly. So I often tell patients that if hydrogen SIBO feels like your gut is stuck in fast forward, methane SIBO is like someone hit pause and then walked away. So, what many people don't realize is that hydrogen and methane are always linked. Methane producing microbes like Methanobrevibacter smithii actually rely on hydrogen as their fuel source. So, even if your breath test only shows methane, hydrogen is still present. It's just being consumed to create methane. This is why some people swing between the SIBO symptoms, and also why treatment almost always needs to target both hydrogen and methane to be effective. So how do you know if you have methane SIBO? The most common way to test for methane SIBO or EMO is with a SIBO breath test, and the results are then compared against thresholds set by the North American Consensus on SIBO testing. It's non-invasive. You drink a sugar solution, usually lactulose or glucose, and then blow into a series of small tubes over a few hours. The test measures the gas levels your gut microbes produce as they ferment the sugar, which gives us clues about what's growing and where. When it comes to methane, most labs consider a level of 10 parts per million or higher at any time during the test a positive. But In clinical practice, especially when there's constipation involved, we often consider anything over 3 parts per million to be meaningful. And that's because even low levels of methane can slow motility and contribute to symptoms long before they hit the official cutoff. And this is one of the many clinical nuances that can lead to false negatives. A lab might flag the result as normal, and a provider unfamiliar with methane SIBO might dismiss them. But to those of us who specialize in this area, levels above 3 are absolutely significant. And here's the other catch. The type of sugar used can make a big difference in whether that methane shows up at all. Some tests use glucose as their substrate, which gets absorbed quickly in the upper part of the small intestine. So that can be helpful for catching early overgrowths, but it often misses methane, which tends to show up lower down in the gut. And that's why many methane dominant cases get falsely labeled as negative. Lactulose, on the other hand, isn't absorbed. It travels all the way through the intestine, giving us a much more complete picture of what's happening along the entire GI tract. So that's the substrate we prefer at Nutrition Resolution because it helps us avoid false negatives, especially in cases where symptoms clearly point to methane overgrowth. I know a lot of gastroenterology practices have started using the TrioSmart breath test, and that's the one developed by the leading SIBO researcher, Mark Pimentel. And it's the first test to measure all 3 gases, hydrogen, methane, and hydrogen sulfide, which is a huge step forward. And I do use that test when I suspect that somebody has hydrogen sulfide or if they have a mixed type. So definitely if they're dominating with diarrhea and with hydrogen, or if they're super sick with some of the other hydrogen sulfide type symptoms, I prefer the TrioSmart test. But many of us who work with SIBO every day, not just here and there, we've noticed that the TrioSmart, at least historically, okay, because it's a few years old, tends to miss methane. So it's one of the only tests that measures the 3 gases simultaneously, but it tends to miss methane. So now, also, though, historically, we've only been able to use glucose as a substrate, and they recently added the lactulose option. So we're staying open, and time will tell if that improves the methane detection. So for now, we still prefer a classic 2 gas test using lactulose because it consistently gives us the clearest and most reliable results when we suspect methane. And that's another reason why we want to treat test results as one piece of the puzzle. They're extremely valuable, but we also have to look at the full clinical picture. And if someone comes to us with a past breath test, we always ask to see the actual report because the details matter. What substrate was used? Which lab ran the test? Do they have a track record of reliability? And what were the actual gas levels, not just whether it said positive or negative. A lot of doctors' offices will just call you and say, it was negative. That's not good enough for us. We want to see the details because the details matter and the numbers give us really important clues. For example, the degree of elevation often helps us decide whether a more aggressive approach is needed, like prescription antibiotics, or whether we can take a more gradual herbal route. It also helps us understand how to target each gas for the best results. So if you've had testing before but didn't get clarity, or if you were told everything looked normal but your symptoms are still very real, there's still plenty that we can do. We also want you to know, if you're considering working with us, that you don't need to go through a doctor to get tested. At our practice, we handle ordering your breath test directly and walk you through what it means in the context of your symptoms. We use this testing as a guide, and we address methane SIBO naturally using a stepwise approach, which we'll break down in one of our upcoming episodes. So that's coming up. Stay tuned on that. Now that you know what methane SIBO is, let's talk about what to do next. If this is all starting to feel like it explains your symptoms, you're not alone. Methane SIBO, also called EMO, is a very common presentation, both in research and in what we see in practice, with studies showing methane positive breath tests in over a quarter of IBS patients, especially those with constipation. And it isn't just about gas or bloating. Methane has been shown to slow motility, impact digestion, and contribute to symptoms that affect daily life. The good news is, once you understand what's driving your symptoms, you can finally start building a strategy that actually works. So, if you're wondering what foods might be making your symptoms worse and what to eat instead, make sure to download our Methane SIBO diet plan. It's a free guide. We're also going to have a couple episodes coming up talking strictly about the Methane SIBO diet. So if you're trying to figure out how to actually get rid of Methane SIBO, we're also going to have an entire episode about that, where we're going to explain our root cause approach that we use here at Nutrition Resolution to fully address and clear methane SIBO for good, not just manage the symptoms. All right, so the thing I want you to walk away with here is you don't have to piece this all together alone. We help clients every day who've been stuck in cycles of bloating, constipation, and second guessing their food choices. There is a way forward, and you're here listening, so you're already on it. All right, guys, see you next week to talk about the methane SIBO diet.